Parkinson's disease is a progressive nervous system disorder that affects millions of people every year. It is one of those neurological diseases which can never be cured. But there are always ways in which one can manage the symptoms of a particular disease. Today, on the occasion of World Parkinson's Day, we have with us Dr. V.P. Singh. He is the chairman of Institute of Neurosciences. Welcome, doctor. To begin with, what is Parkinson's and how does one develop this disease?
So Parkinson's is a degenerative disorder of the brain. In this, the brain does not produce a certain chemical called dopamine. And dopamine is essential in some parts of the brain. It is used as a neurotransmitter, a signaling agent, and some parts of the brain do not function properly in the absence of this neurotransmitter. Now, how does it manifest? There are basically four things that the patient presents with. The first is what we call bradykinesia. There is a paucity of movements, a slowness of movements, and that manifests in every activity that the human body is doing. The second is tremor, where the hands shake, and this characteristically occurs at rest. So it's not when you're doing some activity that this happens, but when the patient is just sitting, relaxing, we get a characteristic pin rolling tremor that happens. The third thing is that the body becomes rigid and frozen. It becomes very difficult and heavy to move the limbs. And lastly, on walking, these patients have loss of balance. When they walk, they tend to walk in short steps. They bend their body forward, and often they cannot control the speed of walking. So loss of balance, frequent falls is how these people manifest.
Okay. What are the possible risk factors of this particular disease?
When nobody knows why this disease occurs or what has caused it, there are a certain genes which have been identified, but they are identified only in a very small percentage of cases. In the majority of cases, why the degeneration is occurring is not known. There are other situations also which can mimic Parkinson's, where the blood supply to the brain gets reduced, and that may present with a similar picture. But by and large, there is no specific cause that we can identify.
Right. When we talk about the short-term and long-term changes that a person who's suffering from Parkinson's can experience, what are those, those changes that they can expect?
So the initial changes are the four signs I told you: paucity of movement, slowness of movement, the tremors of the hand, and which subsequently involve the rest of the body, the rigidity or the tightness of the limbs, and the loss of balance. In the long term, as the disease progresses, there are several other systems which get affected. The sleep gets affected, the patient's mental faculties get affected, they go into a dementia or loss of memory function. There may be behavioral disturbances, and the patient may go into depression. And even the gastrointestinal tract is affected. These patients often complain of constipation. The important point is that this is a progressive disorder. The degeneration continues. So they may start off with a few symptoms, and then over a period of time, gradually the degeneration continues till the patient becomes immobile and cannot walk at all.
Okay. You just said one of the long-term changes is depression. So with Parkinson's, people often find it incredibly difficult to cope with depression. Any suggestions from your end as to what they can do to deal with such a situation?
So depression is a fairly common manifestation as the disease is progressing. And our aim is that even when the disease is not severe, we have to get the patient into a rhythm. So we say they must have some activities. Meditation, for example, would be very good for them. Yoga, done regularly would help. A lot of social interaction so that you keep the depression at bay. So all these measures we try to institute early so that the patient does not go into severe depression. The other thing is the family has to recognize that the patient is going into depression. And at that stage, they have to seek medical attention and they have to seek help so that the patient's depression can be taken care of by medication.
Right. How can one know if their Parkinson's is getting worse? What are the warning signs and symptoms they should look out for?
So basically, the initial signs that I said, the slowness of movement, etc., that keeps on increasing, that keeps on worsening. So if the patient, for example, takes 10 minutes to get dressed, suddenly they find over a period of time that they're taking much longer to do the same activity. One could also time their walk and see what is happening. Over a period of time, it takes them progressively longer to do the same routine day-to-day activities that they could do easily earlier. In addition, the patient himself will find that the balance is getting worse, there are more falls, and therefore they can seek help that thing is worsening.
Right. So as a family person, what can a loved one or if someone's near or dear one is suffering from this disease, what can he or she do?
See, here is very important for the family to understand that whatever is happening is beyond the person's control. Often the family or caretaker would get irritated. Why aren't you walking faster? Why are you being lazy? These patients are not being lazy. They just physically cannot do it. So one has to not get frustrated or angry at a person for not being able to do a thing, because it is actually beyond his control. So the caretakers have to realize this, and they should know that it's going to get worse with time. So they have to give adjustments for the patient for all these things. But good, tender, loving care and understanding, rather than getting frustrated or angry, is how the caretakers and the family should deal with it.
Absolutely. After knowing the severity of this particular disease, we want to know if this disease can be prevented. If, then how?
Unfortunately, there is nothing that we can do to prevent this disease. What we need to do is to recognize that something is wrong, get early treatment so that we can give symptomatic relief, the patient can get better. And medications are available, a good number of medications are available, which can help the patient to improve and lead a normal life. But as time passes on, being a degenerative disorder, it continues to get worse. And at that time, the medicines have to be stepped up. The requirement of increasing doses of medicine, again, is an indicator that things are getting worse. But unfortunately, on these medicines, we don't have any medicines which can halt the progression of the disease. But we can certainly control the symptoms and make the patient's quality of life much better.
Right. When it comes to the treatment part, what are the possible options that are available in India for these patients?
So the best is that, as I said, early recognition of the disease, starting treatment early. With medications, we have a variety of medications we can use. And with the medications, we can make the patient symptomatically better. His quality of life can improve. He can walk. He can do his day-to-day activities. And a regimen of exercise, yoga, meditation to take care of the long-term problems. And then these medicines work very well for 5 to 10 years. But after the period of time, the degeneration has progressed. So the amount of dopamine which is left in the brain is much reduced. And after some time, despite increasing medications, we do not get a response. So initially, there was nothing we could do for these patients. But there is a surgery which is developed, which is available in India, which can be done for Parkinson's. This surgery is called DBS, or deep brain stimulation. So effectively what we do is we insert an electrode or a wire deep in the brain to a particular area of the brain, and we connect it under the skin to a pacemaker, like a stimulator. Now, the stimulator is like a pacemaker, as many people would have heard. It's kept under the skin. And this sort of fires electrical stimuli in the deep-seated areas of the brain where Parkinson's patients have a problem. So the normal dopamine is not being secreted, but with the stimulation, we increase the activity in that region. And in end-stage Parkinson's, when the patient has severe disease, severe disability, and the drugs are no longer working, now we have a therapy, a surgical therapy, which is extremely good and which can again make that patient walk again, almost like a miracle. The important thing is that we should not wait till the brain is totally degenerated and even the stimulator cannot help. So these patients need to follow up with a neurologist, a movement disorder specialist who can judge them, who can follow them up with medical therapy. And when the appropriate time comes and the therapies are stopped to act, then we can do the surgery and make the patients do well or get back to life. This surgery is now available in India for a number of years. We at Medanta are doing it, centers which are doing it. And this is expensive, but it can really change the life of the patient once the disease is fairly advanced.
Right. So is exercising and physical activity safe for these patients? Because you said
absolutely. Yeah, it's not only safe, it is mandatory. I think these patients have to be on a regimen of regular exercise. They have to sort of keep doing exercises for the limbs because the tightness of the limbs has to be reduced with exercises. They get chest problems, so they have to do breathing exercises, and they have to go for walks so that at least, we can keep them in good shape for the times to come.
Right. We often hear that change in lifestyle is equally important aspect for Parkinson's patients in their treatment process. What are certain lifestyle measures they should keep in mind?
So regular exercise, a good nutritious diet, a mental attitude. You have to stay positive. It's often, people do get into depression that I've got this disease, it's incurable. But the good thing is there is a lot of things that we can do to keep the person in good shape, including surgery. So they have to stay positive. They have to be moving. They have to avoid depression. And they have to take the drugs regularly. And lastly, over a period of time, the speech output also goes down because those muscles also are not working well. So their voice becomes very sort of slurred and low volume. So for that, what we often tell our patients is to use, to speak loudly and especially to sing. I mean, if somebody is doing aarti or bhajan or, even somebody enjoys songs. So put the songs on and speak and sing them at the loudest of your voice. So that these set of activities would help you to be in good condition for a much longer time.
Right. Does age play a major role as a risk factor for this particular disorder?
When most cases come in the 6th decade of life, and that is the norm. As they age, as the brain is aging, then the degenerative changes set in. And that is the commonest age when this starts. In addition, with age, the blood circulation to the brain goes down. So there are another variety of disorders which mimic Parkinson's, what we call Parkinson's plus. And in these cases, the degeneration is more widespread than just the dopaminergic pathways. So there's an overall degeneration. So in addition to the Parkinson's symptoms, the cognition or the memory becomes very severely affected. Other features come in. And these type of cases where the degeneration is more diffuse and more widespread do not respond very well to medicine. And they also do not respond very well to surgery. So whenever we see a patient, we try to differentiate between Parkinson's and Parkinson's plus syndrome so that, we can give the appropriate therapy.
Right. When we talk about depression, if a person is undergoing treatment for Parkinson's and is also into depression, should he or she be taking any medicines for depression as well, or there are, they should refrain themselves from taking other vaccines or medicines, anything to lower down the other symptoms?
If the depression is severe, certainly we give them antidepressants and it works and it makes them better. But as I said, a positive attitude, the other factors to try to increase the social interaction, making efforts to go out, not in COVID times, obviously, but in general, I think, we can give, there is no restriction to give medicines, but it should be in consultation with your movement disorder neurologist so that we have to avoid certain drug interactions. So depending on the drugs that he's giving, and the antidepressants have to be adjusted so that they don't cancel out the effects of each other.
Right. What are the current clinical trials available for Parkinson patients presently in India? And how can one enroll themselves?
See, at the moment, because of COVID, there are no clinical trials going on. There are a variety of new drugs which keep coming, which we keep trying. And the movement disorder neurologist would be aware of these and would help you to enroll in one of them. But at the moment, practically, there are no clinical trials going on.
Right. Thank you, doctor, for giving us your time, for sharing such insightful information to our viewers. It was really great. And any other suggestions, any other something that you want to share from your end?
See, there is, people may have seen a video circulated on WhatsApp about apomorphine pumps. Now, apomorphine is a drug which relieves the Parkinson's symptoms, but it relieves it very rapidly. So it is a good drug which can be used. People would have seen videos of people with Parkinson's, being injected and suddenly getting up and walking well. So it's a good drug, a bit expensive. The problem is that it is very short acting. So people can get that drug. Most Parkinson's drugs would take 15 to 30 minutes to act. So if the patient is in a phase where there is a lot of effect and the patient is severely affected, a shot of apomorphine, which is an injection, would help to get them up fast while the effect of the rest of the medicines comes. But the effect lasts only for 45 minutes. So it's not a good drug to take in the long run. It can be used as a rescue drug for a short duration, but not as a regular treatment.
Right. I'll end the video here.